Hello, everyone. It's Friday, May the 29th, and another really good day as far as I'm concerned, from the standpoint that we don't have any more additional deaths today as well. And let's just hope and pray we're going to be able to string this together and keep it moving in that direction, because I know we still got some stormy seas and some rough road ahead of us and everything, but I'm not naive enough to believe that we're at a point in time where we're not going to have any further deaths. But let's hope and pray we don't. And like I said, since Wednesday we haven't had one, and that's really good. And we just are hoping and praying for everybody that they stay well and the sick get well. So, nevertheless, I've got a couple things that I've got to read to you. That this is week 5 of our West Virginia Strong, the comeback reopening plan. Another round of the reopenings begins tomorrow, Saturday, May the 30th, and you can see them on your screen. But the spas and massage businesses, the limited video lottery, swimming pools, bowling alleys, pool halls, roller rinks, and other places of indoor amusement will open tomorrow. And today I am signing an executive order which allows these businesses to reopen. Week 6 of our reopening plan begins Monday, June the 1st. With the reopenings that are scheduled, and you see them there that are scheduled for Friday, June the 5th. And there'll be guidance for our movie theaters in just a very short time up on my website. I want to go back. I promised you today that I would give you more guidance as far as our summer sports events and everything, primarily Little League or soccer events, for our youth and our children. We're going to do it this way. We're going to allow practice to begin on June the 8th and games to resume on June the 22nd. These are low contact youth sports. And that's the one, that's the way it'll be. Our medical experts now agree that it is safe to allow the WVSSAC sanctioned middle and high school athletics and bands to hold their summer training programs beginning on Monday, June the 8th. Now, you'll see the SSAC guidelines, that have come out. I've worked very closely with the SSAC. They've done great work. Their executive director, Bernie Dolan, should be really commended, as well as our superintendent of schools, Clayton Birch. They worked hand in hand with one another, and Ohio has already restarted its youth sports training programs. We're a little behind Ohio, maybe a little ahead of some others and everything, trying to split the middle as best we possibly can. Additionally, we will allow all the remaining adult sports facilities to reopen on June the 8th, and our guidances will follow very soon, and this includes indoor tennis and racquetball, outdoor basketball courts, and others. And so, you'll see all that. And again, you know, what we're doing is we're opening practice up for the youth sports on June the 8th. We're opening games to be allowed on June the 22nd, in which we will, at that point in time, allow spectators to come to outdoor events, and outdoor equestrian events with spectators will be allowed on June the 22nd, and as well as other sporting events, provided that there is absolute mandatory social distancing. And the guidances will be up on our website soon. You know, what this means is we'll be able to have, you know, a Little League game, provided we keep an absolute distance between the fans that are there, the moms and the dads that are watching those kids, and the same way with the equestrian events or whatever it may be, beginning on the 22nd, and we have got to maintain this social distancing. Now, let me go to one thing that I want to, you know, that it's a little out of order, but I wanted to talk to you about anyway. There was a livestock auction. Now, you know, we absolutely, you know, from our standpoint of our farmer markets or our livestock auctions and whatever like that, we have deemed them essential. There was a livestock auction in Jackson County, and we had like 700 people came to it. And we have some pictures of it. I don't know if Jordan, I don't know if you don't have a picture of this, okay? But we had 700 people basically jammed in together. Now look, what happened from that, at least right now that we know of, and there were several people probably from out of state there and everything as well, but from that, for what we know right now, we have at least 2 positives that have come up. Now look, I keep telling everybody just the same thing. We can't watch you in everything you do. You've got to really be smart. Absolutely, there is nothing that is worth risking your life for. And there is some amount of risk. And if you were to get this, and you would happen to have some level of chronic illnesses or age or whatever it may be, or maybe even, you know, a young kid. You know, we've lost a couple of kids and everything that were 20 or 25 years old. Now, look, absolutely, we cannot jam everybody into a shelter like we did in Jackson County, and I know that's happened in other places. Now, come on, we can't do that. We have got to maintain some level of social distancing if we're going to be able to come to these events and do this kind of stuff, or it's going to backfire on us. So I would tell you, absolutely, we have got to follow the guidelines. We've got to do the stuff that will make us the safest and go ahead and be able to live our lives. So please take heed to what I'm saying. Now, I don't have a whole lot more other than to just tell you now we have 11 completed applications from cities and counties. We're working this, and as soon as we get applications where you know that we know that you can, that funds, you know, you've applied for them correctly and everything, and our people sign off on them. We got checks coming out, and they're going out just as fast as we possibly can kick them out the door. We encourage all the cities and all the counties to get the applications in as quickly as you possibly can, and we'll get you dollars right behind that as quickly as we possibly can. And I'll promise you we'll get them out and get them out really quickly. I've got an update on the Huttonsville prison. I missed that just for a second, but the Huttonsville prison, now we have 116 confirmed positive cases. Yesterday we had 105. All the staff have been tested, and there is no additional positives from the staff. This is really important to the people that are around that prison, around in that county. We are offering now free testing in Randolph County tomorrow because of the outbreak at Huttonsville. You know, the testing in Elkins will be at the Davis Medical Center. In Mill Creek, it will be at the Valley Health Center. and testing at both locations will run from 10 a.m. until 4 p.m. So if you're feeling the least bit bad, or you're feeling the least bit anxious, or whatever it may be, and you think you should be tested, please come out and take advantage of that. It won't cost you a dime, and it's painless. It takes every bit of 10 seconds to do it, and so I encourage any and everybody that has any concerns whatsoever, come and get tested. I mean, it's just the right thing to do, and please do that. I've been tested myself, and there's nothing to it, and my wife is exactly the same. So please take advantage of that. The only other thing I have is additional testing for minorities and vulnerable West Virginians, or anybody, like I said, that has any level of anxiety and everything, will be going on today and tomorrow in Berkeley, Jefferson, Kanawha, Mineral, and Morgan counties. And this is optional testing. It's free. It's just what I just said. It's available to all the residents in these counties, and whether you have any kind of level of symptoms or you don't, just take advantage of this and run and get a test. It may very well save your life. It may very well save somebody that's very, very close to you, a loved one. So just take the time to run and do it. It won't take a second, and I think it'll relieve a lot of stress and anxiety and everything, and it'll make you feel better. But please try to get out and do that if you choose to do so. The only other thing I've got is to remind you again and again and again about the census. We got to get counted, West Virginia, and I'm really after you like crazy to do that. So if we could have just some volunteers, whether they be in those communities or on a road or on a street, that would just take the time to call everyone. That's what you got to call and do, and it won't take a second to do it, and you'll get counted. And I promise you, there's not any boogeyman that's going to come and get you because you're counted and everything. Just get counted, and that'll be really good for all of us. Last thing, if we could do the graphs. You can see the top one. The top one is the recovered cases and the active cases. The active cases are on the bottom. The recovered cases are on the top. We now have 1,241 recovered. It's all moving in the right direction. We have 636 as far as still active, and you can see the bottom line is slanting down just a little bit. The top line's still growing. That's exactly what we want it to do. That's good stuff. The next graph is our daily percentage of positive cases. The daily percentage today is less than 1%. It's 0.95 of 1%. So that's, just barely less than 1%. It's a great number. We haven't been down to that level in a little while. We had a couple of days where we were less than 0.5%. But then we bumped up a little bit. The big spike there, the spike you see that's at 7.15 is all Huttonsville. And so, or primarily Huttonsville. And that's what we've looked for. That's the science and the math to this whole thing, as I've said a bunch of times. That's what we look for. And then when we saw that, we run to the fire, and we put all the king's horses and all the king's men to try to take care of the issue. And I hope and pray we're ahead of the game as far as Huttonsville. I hope and pray we're ahead of the game as far as being able to test all of our other correctional facilities and jails. And we're moving on that. And the great people that you'll hear and see from in just a second, are continuing to do great work on all that. Our cumulative percentage of positive cases has now dropped again. I mean, we were like 1.91, I believe, is the lowest we got. And then we moved all the way back to 2.11, and now we're back to 2.09. So that's good. The number of deaths, that we didn't have a death today or yesterday is really good. As As far as our trending, you know, the amount of positives at our percent level is just above 2. Kentucky's at 5. Maryland's at 18. Ohio's almost at 10. Pennsylvania's at 16, and Virginia's at 14 and a half. And so all these numbers are good. The amount of testing that we do in West Virginia compared to the nation and all of our surrounding states is just out. It's the bottom left-hand side of your chart there. You know, we're way ahead. We're in the dark blue, and we're way ahead as far as the amount of tests that we've done. All this stuff is good, but I keep going back to one thing. We are absolutely the most vulnerable state in the country. We're the oldest state. We have more chronic illnesses than anybody. We're sitting within a rock's throw of 2/3 of the population of the country. This thing, because all the numbers look good, we got to reopen. We all know that. We absolutely are trying in every way to get ourselves reopened and give ourselves more of the liberties that we had at one time in our life back in every way. But we've got to know that we got to be smart. 700 of us cannot jam into one shelter and not expect some bad events to come. We have got to be smart. We have absolutely got to stay right on top of our game, and absolutely will weather this storm. If we don't watch, this thing will turn around and bite us, and it will really bite us bad. So please, take heed. Enjoy your weekend. We'll continue to watch every single moment, every single hour of every single day. But please, please, take heed, West Virginians. You've made us really proud so far. Keep doing it. Thank you.
All right, thank you, Governor. Let's first go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. A couple items to highlight today is the governor pointed out significant amount of testing going on over the next several days. So a major effort on the part of the National Guard to work with our state and local partners to ensure the appropriate manpower and logistics support for those test lanes that the governor laid out. Also want to highlight a couple of things related to PPE and test material, test kits. We continue to work hard every day with a significant level of staff to source PPE. The governor's tasked us to maintain the appropriate level of reserve for any surge capacity requirements that we may have as we open back up or as we go into winter and potentially next spring where there may be surge requirements that we need. So that work is still ongoing, and PPE still becomes and is a national challenge. In addition to that, I know a lot of people have asked questions in the past few days about the volume and speed of testing. I hope folks will please understand that as with PPE, there are challenges with testing supplies, test kits, and equipment. We work with our DHHR partners and others and are continuing to source materials to make sure that we can keep up the speed and pace of testing that's been laid out to us by the governor and our medical professional team. So we'll continue to work those. In addition to that, significant amount of work going on across the state of West Virginia with outreach, subject matter expertise support as sectors open back up related to sanitization, PPE, distancing, and other activities that help us continue to mitigate the potential spread of the virus. I'd also like to highlight a couple of initiatives going on with VOAD, Volunteer Organizations Active in Disaster. You've heard the governor and I talk about VOAD and the significant role that they play in our emergency response statewide. This week and next week, VOAD is working an initiative on domestic violence support, providing food, supplies, PPE, and PPE training to our domestic violence shelters. It's important to understand that since this pandemic started, that some of our domestic violence shelters have seen a 30 to 40% increase in the number of individuals coming and seeking support. In addition to that, VOAD is working with local partners in Charleston, Wheeling, and Parkersburg to source shower units for our homeless population. And that's being supported by the American Baptist Men as well as the United Methodist Disaster Relief, two more partners that we have as part of our volunteer organizations in response. Last thing I'd like to update folks on Mountaineer Challenge Academy. We have had great success with our Challenge cadets and the virtual training that we've been doing with staff and faculty. Over the next several days, we will have Challenge cadets, 109 of them, who will come back in small groups with the appropriate testing, social distancing, and other requirements for sanitization to bring the students to Camp Dawson to allow them to go through the testing requirements that they need to potentially meet their high school diploma option. Those who meet the diploma option will graduate. All 109 cadets, we believe, will graduate from Challenge. History shows that about 84% of those kids will achieve the diploma requirements. We also ask for a waiver from the National Guard Bureau, so the students who don't meet those high school graduation requirements will be allowed to go into our Jobs Challenge program once we start that back up and be able to finish their high school diploma through the Jobs Challenge program. 38 cadets and their parents, family, and guardians have chosen to roll over into the next Challenge cadet class. But I think the great news is, of the kids who left when we asked them to go home during the pandemic, we have stayed in contact, and we have all but 2 cadets who have continued on in the program. I think it's a great testament to our staff and faculty. And last thing related to Challenge is we have not dropped the ball during the pandemic on the things that we need to do to stand up the second Challenge Academy that the governor, our legislature, and our congressional delegation advocated for and were able to help us get. We will be on track to start the next Challenge Academy program in Montgomery in October. So a lot of great work going on, staff being hired, and in the near future, the governor and I will announce some of those staff hirings to include directors. Thank you.
Thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I want to focus my comments today on what the governor suggested, which is the pathway that we can continue to take to make sure, as we continue to open and learn to live with the COVID virus, that we can be safe. So I know that there's information that's out there, particularly quoting the World Health Organization about their recommendations that people only need to wear masks in public when either taking care of somebody sick with COVID or having somebody with COVID that's been diagnosed to prevent them from spreading to other people. And from my read, the World Health Organization's perspective is based largely on the fact that they believe that masks could cause some false sense of security and people don't know how to use them so well, and that it might rob from medical personnel. And the CDC, on the other hand, our sort of Center for Infection and how we should respond, is moving in really quite the opposite direction. They start off saying, well, masks may not help, but now I think that they believe the scientific evidence, as I do, and the medical evidence really suggests that masks are the most important new component of our successful reopening and living with the COVID virus. The philosopher and poet Anna S. Nin said, "We don't see things as they are, we see things as we are." And I think that this is true when it comes to masks as well. But let me just make a case that for West Virginia, mask is a really critically important additional piece of our weaponry, of our solution set against the COVID virus. So in Asian cultures, and I'm going to quote 2 countries, masks are very, very commonly worn in public, worn in outside, inside. And let's look at 2 Asian countries. Let's look at Hong Kong and Japan. We've talked about this for a second, but I think it's worth revisiting, particularly given this budding new controversy about masks. So there's a lot of evidence that masks help. And in fact, some people say masks are like a vaccine. And remember, wearing a mask is not to protect you, it's to protect people around you. It's an act of altruism, an act of love for other people around you. So let's look at Japan and Hong Kong. Hong Kong has a population of 7 million people. Japan has a population of 127 million people. They are mask wearing cultures. And let's compare them to a country that decided to attack the COVID pandemic as Japan and Hong Kong, which both remained open and schools remained open, stores remained open in Japan and Hong Kong. But so did they in Sweden. And Sweden decided that they didn't want to wear masks, that they trusted their people to socially distance and do the good hand hygiene. So again, and the country of Sweden has 10 million people population. So again, remember, Japan, 127 million population, Hong Kong, 7 million population, Sweden, 10 million population. So let's look at the deaths from COVID in these countries. In the country of Japan, which has 127 million population, 884 people have died from COVID infection in Japan today. In Hong Kong, a country that has 7 million people, 4 people have died from COVID infection in all of Japan so far. Let's take Sweden. That's a country that decided that masks really didn't matter, that they could trust their people, that people would be okay. Most people would be well. 10 million people population, they have had 4,350 deaths from COVID so far. So for me, the scientific evidence is clear, but this evidence, trying the experiment, 2 countries that wear masks had a markedly reduced number of deaths, and Hong Kong, about the same population as Sweden, had 4 deaths compared to 4,300 deaths. So for West Virginia being the most vulnerable population and being smart and being caring and caring about your neighbors and caring about our state, please, as a sign of concern and care and love and altruism, please wear your mask or your face covering, particularly when you're around other people and you cannot distance, because we want you to be safe, but importantly, we want West Virginia to continue to shine. So thank you.
Thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch.
Good afternoon, everyone. Just a quick update on the Pandemic Electronic Benefits Transfer Program. At the beginning of the month, DHHR and the Department of Education announced this program to transfer monetary benefits on an EBT card to families with children that would have received free or reduced lunch at school. This PEBT card can be used everywhere. The SNAP EBT can be used, and the benefit is equal to the value of a free breakfast, school breakfast, or lunch reimbursement rates for the schools are closed. Because this involved benefits to families and children, the governor asked us to speed this up as quickly as possible. I want to thank our staff at the Bureau of Children and Families. Last weekend, we issued more than $21 million in PEBT benefits to families and their children. So again, I want to thank the Department of Education and especially Clayton Birch for being a good partner with this. We'll continue to update you. All of these benefits will be made available through the end of June. So that's all I have. Thank you.
All right, thank you, Secretary. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Paul Mullen with WCBC Radio.
Good afternoon, Governor. Good afternoon, everyone. Hampshire County Health Department reported yesterday that 14 people from the same church had tested positive for COVID-19. Is this an island, or is this a bigger problem than we may suspect? And what kind of follow-up is taking place at that church?
Secretary Crouch or Dr. Marsh, one of y'all are going to have to take this.
Yes, Governor, I'm happy to do that. I do not have the specifics on this incident, but what we will be doing, as we do with most, is contact tracing. We follow individuals, ask them who they have been with, who they've been around for the previous couple of days, and then we look at who they've been in contact with. Individuals who have been in contact with them may need testing or may need to self-quarantine. Churches, as Dr. March has talked about, are critical in terms of these spreads, and we need to make sure that when they have church services, that individuals do social distance, and we use every other pew, and folks are careful with regard to sanitation and wearing masks, which I know is difficult when you're trying to sing. Singing is one of the worst things that can be done with regard to spread. So please be careful out there. We'll provide an update on that situation at the next briefing that we have.
All right, thank you, Paul. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, everyone. Mark Curtis with the Nexstar Media. I have some questions about the numbers in Randolph County. So we're up to 116 prisoners, but I believe I have a total of 131 people in the county that have tested positive. I'm curious as to how many of those were prison employees and how much contact tracing is being done or has been done, because it occurs to me if it spread like wildfire in the prison, some employees could have brought this out into the community and spread it a great deal before finding out they were positive.
Mark, your concerns are valid, and really that's why we're wanting to do that additional testing. I think it begins tomorrow, if I remember correctly. And let me just double check that to make absolutely positive. But yes, it's tomorrow. I want to announce it one more time. Tomorrow, for the people of Randolph County, they'll be testing at the Davis Medical Center and in Mill Creek at the Valley Healthcare facility, and that will be from 10 to 4 o'clock tomorrow. But, I think we don't have any new employees that have, that have come out positive with our last batch of testing. And so, Mark, your concerns are valid, and in that an employee could very well have transmitted this back home or in a store in the area or whatever like that. We're trying to stay on top of it, and our people, and I think Dr. or Secretary Krause, maybe you could comment some more on this, but as we continue to move forward, we're going to shut this down some way, somehow.
That's correct, Governor. Governor is absolutely correct in terms of following this. Again, in terms of the contact tracing, we're adding people daily. It's a good time to announce that we have 33 DHHR employees who have completed the instructions and the course for contact tracing. So we have more and more people who are available to follow a lead. As we get a positive case, we follow the leads from that individual out until there are no more leads. So again, we will report back on that as soon as we finish the testing and we have complete information. Still takes a day or two to get the test back on individuals. And as the governor said, we haven't quite finished testing yet. So I would say Tuesday or Wednesday of next week, we'll have a better idea of what's going on there.
Come back to me just one second, if you would. I just pulled up something here, and in regard to Huttonsville, the last 370 tests that we did, all of them came back negative except for 4. We have now done more than 900 tests that have come back negative. I want the people of the area to know that again, in an enclosed facility, that's always the most dangerous, and we're absolutely on it. We're trying with all of our ability to make sure that we protect those that are in that facility, as well as protecting all the people that the staff comes in contact with outside of the facility. I would ask you to just do this for us. I know you're concerned. We're always concerned when we have a hot spot light up somewhere around. We're always concerned, but especially concerned when we have that happen. You can really help us in Randolph County if you'll come and be tested, because we'll then be able to see if we've really been able to contain this situation in a really good way, or if we've got even a bigger situation within your county and everything. From the standpoint of community spread, we have got to have your cooperation here, and so please take advantage of that testing. It's that's going to be going on tomorrow. It just takes a second, and come and do it. And absolutely, I'll promise you that all the healthcare people, all of the medical experts, they're all on board, and they're trying every way that they possibly can to assure that you're safe. And so just try to help us if you can. The more information we have, the better work we'll do.
All right, thank you, Mark. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, this is Taylor with the Herald-Dispatch. Governor, I was wondering if there was any thought as to when or if Camden Park in Wayne County could reopen.
Well, that's not come, to my attention. I think we're still working on, from the standpoint of parks and festivals and state fairs and all that. We don't really have a real solution on that, thus far. I think I don't know of any other states that have opened, to festivals and fairs, and so that's a real problem, and we're trying to work on it as best we possibly can, but I don't think we have any answer as to how we're going to be able to go on that right as of yet.
All right, thanks, Taylor. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hello, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, restaurants have been put under some fairly strict guidelines, which could cut into already razor-thin profit margins. You're a businessman. You've said several times that you get it, As we see more research that's coming out, and this may be something that Dr. Marsh can chime in on, that shows that the contact surfaces might not be the conductors of the COVID-19 virus that we thought they once were, that it is much more moisture droplets, and person to person, it's airborne moisture. So if that is the case, some of the restrictions that involve plastic utensils, disposable menus, and most importantly, maybe beverage services, which have to be cans or bottles, where many restaurants have had to shut down their soda or drink dispensing machines, which account for a large part of their profits. If there is a concern that it's surface contact, that makes sense. But how nimble is the administration in maybe lifting those restrictions in light of new information that comes out that says contact surfaces might not be the problem that we thought they were?
Well, let me start off, and then maybe I'll defer to our medical team, if need be. But Kenny, you'd have to say this. I may not look it, but we've been pretty dadgum nimble in this whole process. We've moved very, very quickly. We've adjusted. We've absolutely had to pivot and move quickly. And that in itself has really enabled us to produce these numbers that we keep talking about over and over. Now, from the standpoint of the restaurants and the economics of it, I totally get it. I completely get it. It's very, very difficult to run a restaurant on 50% capacity and everything. I completely get it, understand it through and through. Now, the other side of it is just this. As we get more and more information from the standpoint of our utensils or the menus or whatever like that, we may very well be able to pivot on all that, and that may not be a real concern. The concern is this, though. Here is the concern, I think, of the medical department, and that is this. You have people sitting, just like I'm sitting here right now, and they're sitting here for a good amount of time. They're not moving and everything. And as they're sitting, they're talking and they're doing all kinds of different things in a restaurant, and that exposes us that are close by. And in most of our restaurants, you know, the seating capacities and so on like that are not just unlimited, because unlimited means that they're much, much higher cost, great big buildings and so on like that. So we're in a smaller area, we're sitting, we're not moving, and we don't have any mask on, and, you know, we're talking and doing the things that could spread the disease. Now, we're working it, and I don't know of anything other than just to tell you just this, as quickly as my experts will tell me, as quickly as they can tell me that we can remove that capacity level or back that capacity level down to 25% or raise the capacity to 75%, or maybe raise the capacity to 90%, or raise the capacity to 100%. You know, absolutely we'll do it. You know, but now I'll defer to our experts, as I've done over and over and over, and maybe Dr. Marsh or you know, Secretary Krause or somebody else will weigh in.
Is it okay if I take this one?
Please.
Yeah, okay, great. So thanks for the question. I think that, you know, Kenny, you're a smart guy, and you are reading actively, as we all are. And, you know, we are learning about the COVID virus, as the governor said. We know that it's not zero risk of you know, picking virus up from surfaces and introducing it to your nose, your mouth, or your eyes, but it seems to be lesser. But we also know that in certain settings inside, and there was a restaurant in China, that the air distribution picked up the droplets and spread them in a sort of a way that the air flowed in that restaurant. And so we're trying to work with all the restaurant owners and do everything we think can make that the safest, great experience for the guests. And as the governor said, as we both gain more information and as we have more experience and we see that people do well in these situations, then of course we want to lessen the restrictions and want to try to reduce the number of different sort of interventions these restaurant owners have to make, because it's such a challenging business anyway. And all of us enjoy going to our great restaurants and our incredible chefs and owners and being with the people that we care about and love. But right now, we believe that doing that in the safest way possible is important. And as we have good outcomes and good experiences, then certainly, as is warranted, we would recommend to the governor to release some of those restrictions. But we're right at the beginning now. But your comments are very wise and thoughtful, and I appreciate the great job that you do.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Charles Young with WV News. Governor, I know you've said, repeatedly that you're confident that the CARES Act guidelines will be changed to allow states to backfill, but they have yet to be changed, and it's almost June. Have you and the folks at the Revenue Department landed on a date at which you would have to call a special session? I would imagine it would take a week, maybe more, to figure out how we would even do that. Are we running out of time to do that? Do we have a date decided yet?
Charles, we're not running out of time. In fact, I can tell you that in meeting again yesterday, we meet every day. The revenue people and I purposely meet every day, and we meet right at the close of business on a day, because I want them to gain all the information they can gain through the course of the day and then bring it to me at the end of the day. Now, let me tell you just this. Unless I am really surprised, we're not going to have to call us back into special session. Absolutely, the revenues every day are coming in higher than what we projected them to be. And without any question, what we're trying to do right now is we're trying to check in every single agency under every rock, any and everything we can do to try to make sure that any dollars of federal money that we're entitled to in West Virginia, that we're going to take and get. Now, we're not going to mow up against the fence, but we're going to mow as close to the fence as we can mow and absolutely get every dollar to West Virginia that West Virginia is entitled to get. Now, in doing so, all of our revenue people yesterday, as recent as yesterday, all of us believe now that we're going to be able to get to the end of June on the cash that we have and the cash that we're getting in without any further changing of the guidelines than we have today. So right at this second, from the standpoint of now till the end of June, I think we're rock solid with no changes beyond the guidelines that we have right now. It's been great work by a lot of our revenue people, led by our Secretary, Dave Hardy, but absolutely the people that are underneath Dave are doing great work, and I'm meeting with a bunch of them every day. They all come, they all have their information. We go over every single bit of it. Things can change, and if things change, we'll pivot and move very quickly. But right now, I think we're rock solid until the end of the year as far as cash, and I do still believe that the guidelines will continue to change and improve towards the state of West Virginia to where we'll be able to even do more. As of now, and I think this number is that there has been a total of dollars that have been committed to the state of West Virginia. Now, some of these dollars are in education, K through 12, some of them for hospitals, some of them for higher ed, lots and lots of different buckets, that are coming into West Virginia. But today, the dollars today that are committed to West Virginia are $2,130 million. But in addition to that, just like I've said over and over, I really believe that there will be an additional stimulus come that will even go higher than that. And I really believe there'll be some additional changing of guidelines that will enable us to do more backfilling than we've already done. But as far as our cash and as far as the special session, right now I see that our cash is going to be fine, and I don't see a need to bring us back into special session between now and the end of the year, unless it looks like the beginning of the new year is going to cause us a lot of trouble. But I think we're in good shape. I've said it over and over, but our people have done a real job, and this I have said, and I've said very confidently, I'm a business guy. This is right in my wheelhouse. This is what I do. And absolutely, so at the end of the day, yeah, I think we're okay.
All right, thanks, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I know that I'm driving Bernie Dolan crazy, patiently waiting for the guidelines to be released, but I know from the SSAC, but I wanted to get some preliminary comments from you all based on something that I was able to read about the low or moderate contact sports, who can participate in phase 1 and 2, and then based on what I was reading, that football and cheer can't have contact until August with normal practices. So I wonder if you can talk a little bit about how those sports are going to be able to plan for the upcoming season.
Okay, man, I'm not going to go through, the tick and tack of all the stuff and everything, but here's how I see it. First of all, the SSAC has tried to develop a plan that they're concerned about kids' conditioning. And so the plan is in different phases, phase 1, phase 2, phase 3. Phase 1, phase 2 is just a conditioning deal, where you bring kids in and you're just doing conditioning and you're staying a distance from one another and all that. And the other flip side of it is they have added that they're going to make every effort, we need to make every effort we possibly can to do all of the indoor stuff outside if we can do that. They've limited the conditioning, I think, to an hour a day, you know, and everything. And then as we move forward beyond that, you know, from the sports that are non-contact sports, you know, I mean, you know, like football, you're boom, right in each other's face. You know, wrestling, you're right in each other's face. You know, cheering, you know, you're doing all the flips and everything else that you're doing. You're touching one another an awful lot and everything. In the other sports, you know, whether it maybe be a volleyball or even basketball, you know, I think what they've decided is just this, that those sports are minimal contact, but the sports that are much more contact and everything, they basically said, as far as true contact and everything, you know, they're going to even shove that off, but they're going to allow activities in groups of 10, I think, and so on like that. But the whole gist of what they're doing is just this, and this is the 80,000 foot. First of all, we need to bring the kids back and keep them apart and let them get back into shape and let them get their conditioning done. And then from that, you know, to the low impact type sports and everything, we can start scrimmaging and doing things like that. And to the other sports, we want to try to keep them in smaller groups and work, you know, on things and everything and protect our kids. That's the bottom line. Protect our kids in their reconditioning, protect our kids in their practices as we move forward and everything to be able to have something that is back to normal.
All right, thanks, Amanda. We have time for one more. We'll go to Steve Adams with Ogden Newspapers. Looks like we're having trouble getting Steve. How about Annie Moore from WVVA? Annie, are you on? Okay, we're having trouble with Annie as well. Let's see, Ryan Quinn with the Charleston Gazette-Mail. Ryan, are you on?
Yes, I am. I know Amanda spoke to this a little bit, but I need some clarification. So if June 22nd, we're going to allow outdoor attendance at outdoor sporting events for low contact sports, which sports are considered low contact? For instance, would soccer be allowed there? Would soccer not be allowed? I think that's right on the edge there. So what are the low contact sports, or you can give me the reverse, what would not be the low contact sports?
Ryan, as we've, you know, checked with all of our experts and all the people, you know, from the standpoint of you know, things like the equestrian events, the soccer, baseball, you know, that, you know, we were primarily looking at youth soccer, little league baseball, things like that, you know, but I think, you know, as we go more forward, we'll have more and more guidelines up on it and everything. But you know, it's surely not football. I don't think basketball was involved in that and everything. But you know, wrestling, football, and stuff like that, no. But we'll have more on our guidelines. But primarily, it was centered around youth soccer and youth little league and the equestrian, the horse shows and stuff like that.
All right, thanks, Ryan. Governor, I'll turn it back to you.
I don't have much. I was getting ready to make myself a note, and I started and I wrote one word, and then I think there was a question, so I don't remember what I was getting ready to write about there. But I guess the thing that I'd like to end with today is just this. Always on Fridays, you know, we try to not bother you over the weekends and everything unless there's something that comes up. It's really, really important. And ironic as it may be, you know, my general counsel just wrote a note about Challenge Academy, and I've already written a note right here about Challenge Academy. And so you know, I want to end by saying this. First of all, enjoy the weekend. Please, please, please be really smart in what you do. You know, keep your social distancing, wear your mask. I mean, for crying out loud, how big an inconvenience in life could that be versus the fact of sitting there, you know, watching somebody really, really sick, or maybe even worse than that we lose. Now, come on, just wear the mask and everything, and we're making great headway here. And to all those people in Randolph County and up around that prison, please take advantage of the testing. And the last thing I'd say is, I can never say enough about our National Guard. You know, the job that they have done is unbelievable, beyond unbelievable. And to think of all the fronts that they're fighting, and they've never lost sight of the ball that they need to try to achieve in Montgomery. You know, it's amazing what they've done for the kids. It's amazing what they've done for all of us. And so absolutely, you know, we're going to have a second Mountaineer Challenge Academy, and we're going to have our second one in Montgomery, you know, a town which really and truly needs that bump. And from the standpoint of that area of Kanawha County, it will be really, really, really good. And I guess I'll end by just saying this. It's a time of year when really and truly tomorrow there'd have been lots and lots and lots of graduations, wouldn't there? There'd have been graduations all over the place, probably tomorrow. You know, these kids worked really, really hard, and their families are really, really proud of them. And I'm really, really, really proud of them too. I hate like crazy in every way that they've been deprived of this opportunity right now, and I encourage schools, you know, and counties and everyone, if you can find a way later on in the summer to have them be able to walk across the stage and hand them another diploma or whatever it may be, do it. Do it. Please do it. It's a really, really, it's a heck of a time of year and a heck of an accomplishment for kids, whether it be in higher ed or our high schools or whatever it may be. It is really an important time of year, and I hate like crazy that this has happened, but I would tell each and every one of you just this. If this is the worst thing that happens to you in your life, you'll have one whale of a life. That's all there is to it. I know you're disappointed and everything. You'll remember, everybody will remember the class of 2020. I will promise you that. You know, not very many people remember the class of 1969 when I strolled across the stage and everything with a graduating class in Beckley, West Virginia of 669 kids. It's amazing, amazing, you know, how big the class was. You know, we've lost a lot of people and everything, especially in the coal fields through the years, but just remember just this. You're loved, you're appreciated, your accomplishments are absolutely noted. So keep that in your hearts, and I congratulate you. I'm really proud of you, and let's all remember our kids and all remember all those that are suffering at this time of year, and keep them in your thoughts and prayers. Thank you again.